Next, let's welcome Director Zhang Jianhua. He is the leader of the Central Healthcare and the Geriatric leader of the Neurological Rehabilitation Team of China-Japan Friendship Hospital. He particularly proficient in cognitive rehabilitation, language rehabilitation, chronic disease rehabilitation, and postpartum rehabilitation.
哎，我说话大家听得到吗？线上的各位专家，各位理解康复界的朋友，
哎呀，跟我可以听见，I can hear you，我可以听见。
太好了，好，非常荣幸能够受邀出席这一次的论坛。
It is my great honor to participate this forum.
线上的各位专家教授，还有体育界、康复界的同仁，我自我介绍一下，我是中日友好医院康复科的康复医师张亮。
Distinguished guests and dear friends, dear colleagues, I would like to introduce myself. I am Zhang Jianhua, Doctor of Department of Rehabilitation Medicine of China-Japan Friendship Hospital.
另外，我还有一个身份，就是中日友好医院康复科的教学主任，我负责全科的教学。
And at the same time, I will in charge of all teaching affairs of the whole department.
另外的话，作为一个中国传统运动疗法这个初学者，我想以上的3种身份，去谈一谈我对中国传统运动疗法在康复中的应用，还有我的一些理解、一些思考。
And at the same time, I am also a beginner of traditional Chinese sport. Today I would like to talk about some of my understanding about how to apply traditional Chinese exercise therapies into rehabilitation.
我将会从以下4个方面去说一下我这个主题。第一的话就是简要的介绍一下中日医院的康复科；第二个带着大家简要的回顾一下中国传统运动疗法；第3个就是结合我们医院还有我们康复科的图解，谈一下中国传统运动疗法在康复中的应用。最后的话会提出一些展望。
I will do my presentation from the four following aspects. The first is a brief introduction to China-Japan Rehabilitation Department. And second is a brief introduction and review of traditional Chinese exercise therapy. The third part would about the application of traditional Chinese exercise therapy in rehabilitation. And finally, I would provide the prospectus for TCET.
下面先简介一下我们康复科。
And next, I will briefly introduce our department.
那么我们中日医院康复科的话，是1984年在大陆成立的第一个康复。
In 1984, we are the first rehabilitation department in the mainland of China.
1988年的话，我们就已经把整个康复治疗技术给专科化了。那么，包括我们的传统的认知语言的康复，都是在国内是手把手领先的。
In 1988, we had already achieved the specialization of rehabilitation techniques, including some cognitive rehabilitation, language rehabilitation. And in these areas, we can say we're the top one in China.
那么在2011年的话，我们科就更名为这个康复医学科。
in 2011, we officially renamed as the Department of Rehabilitation Medicine.
就如这个图所示的话，我们现在有4个部，一个是西区，一个是我们急性期的康复部，还有我们的国际医疗部，还有我们整个区的康复中心。
As you can see in the picture, now we have 4 departments in total. They are the Western Department, the Acute Rehabilitation Department, the International Department, and the Western Department.
那么我们科拥有了国内外先进的设备非常多，包括这个全自动的步态训练评估的系统，包括智能的上下肢的机器人。数训练仪、平衡训练的设备，还有这个3维动作捕捉和分析系统、水中康复系统、虚拟实景等等。
Our department has more than 160 sets of advanced equipment, include automatic robot gait training system, intelligent upper or lower limb rule, kinetic training instrument, balance system, 3-dimension motion acquisition and analysis system, aquatic rehabilitation system, virtual reality rehabilitation system, etc.
那么我们在亚专科方面的话，就是首先我们的神经康复一直是我们的传统项目。那么我们是国内最早开展这个言语和作业治疗这么一个临床康复中心。
And now is a brief introduction about our specialty construction. The neurological rehabilitation is a traditional rehabilitation event in our department. And we are the earliest clinical rehabilitation center in China to carry out speech therapy and occupational therapy.
同时的话，我们医院有一个身份，就是国家的呼吸中心。那么依托国家中心的话，我们在最近5到10年的话，开展这个呼吸康复、重症康复这些康复的话，在国内一直处于领先的水平，是中华医学物理学分会的心肺学组的主掌单位。
There are several national centers existed in our hospital, including the respiratory rehabilitation and the intensive rehabilitation. Those 2 national rehabilitation centers, and we also, as a leader institution, we are in the leading position in the whole China. We are also in the group of the physical medicine and the rehabilitation branch of the Chinese Medical Association.
同时，我们的话，最近这5到10年的话，这个脏器移植的康复一直搞非常好，尤其是这个肺移植的康复。同时，我们还有肝移植、肾移植的这个微手术期的康复。
In recent 5 to 10 years, we did lots of great jobs in organ transplantation rehabilitation, especially the lung transplantation, liver transplantation, and kidney transplantation.
那么同时的话，我们在7年前引进这个日本的外聘专家郭丹教授。那么在郭丹教授的带领下，我和这个日本的顺天堂这个密切，在中国在国内的话，率先开展这个超长期的大修康复。
And since 7 years ago, we expect from Japan, and we collaborated closely with John Tendo University in Japan. And now we are in the leading position to carry out the ultra early and rapid recovery. And we are the earliest institution in China to have this rehabilitation event.
同时的话，我们 我们中日医院的话是国家级的医疗中心，那么我们会通过这个远程康复的设备，定期的给我们的全国各地的和全国各地的医疗去交流这个康复的信息，同时的话相互学习，去传播这个康复的理念。
Because we are a national level medical center in China, and we have lots of telerehabilitation equipment and the service. So we would like to publicize or disseminate disseminate the latest rehabilitation theories and knowledges to other medical institutions.
那我们看的话，这个就是这个。那么大家看最下面，我们最传统这个优势就是我们的神经康复、骨科康复、儿童康复和老年康复。
And from this picture, you can see that in recent years, we have the great tradition in the neurological rehabilitation, orthopedic rehabilitation, pediatric rehabilitation, and geriatric rehabilitation.
那么我们的新的优势就是呼吸康复、心脏康复、重症康复，还有产后康复。
Our new advantages include in the respiratory rehabilitation, cardiac rehabilitation, intense rehabilitation, and postpartum rehabilitation.
就是我们刚才说的，我们的脏器移植为手术期的康复是我们的新的特色。
And our new feature is our operative rehabilitation of organ transplantation.
我们还有一些新的理念和新的模式，就包括这个超短期的快速康复、24小时的康复管理，还有这个远程康复。
Our new ideas include ultra early and rapid recovery and the 24-hour rehabilitation management.
那么下面的话我们就快速的去回顾一下这个传统的运动疗法。
Next, we will review the traditional Chinese exercise therapy quickly.
那么这个就是我们说中国传统的运动疗法是在中国中医学的理论的指导下，根据这个患者病情特点，运用我们祖国传统的这个运动形式，帮助患者进行疾病的治疗还有康复的方法。它呢主要是以运动为主，通过主动的活动，同时的话，我们在整个运动的过程中，配合呼吸、意念，以达到增强体质、防治疾病、改善功能障碍、促进康复为目的的这么一个疗法。
Traditional Chinese exercise therapy, TCET, is a method that guided by traditional Chinese medicine theory and based on the characteristic of patient's condition, using traditional forms of exercise in China to assist in the treatment and rehabilitation of patients' diseases. It is a rehabilitation therapy that focuses on physical activity through active exercise, combined with breathing and thoughts during the exercise process, and to enhance physical fitness, prevent and treat diseases, improve functional impairments, and promote rehabilitation.
最常见的，大家都是非常耳熟能详的，像我们选了一些天五节六字诀、八段锦等等。
There were some some events that we are all familiar with, such as Tai Chi and 八段锦。
那么国际公认的就是中国是世界最早应用运动疗法的国家之一。那么这个中医学的传统技术一法、二点、三针、治灸、汤药，这个其中的法就是导引，指的就是这个运动疗法。那么它是预防保健、防治疾病的重要的干预手段，而且是排在这五者之间的首位的。
China is recognized globally as among the first countries that applied exercise therapy. one of the 5 major therapeutic techniques in traditional Chinese medicine, such as Dao, Bian, Zhen, Jiu, and Daoyin. The first one, Dao, for Daoyin, refers to therapeutic exercise as a primary means of preventive health and disease prevention.
那我们看看2200年以前，就在湖南长的1970年的湖南长沙出土的这个文物里面就有这个导引，那么它们里面共会有44个这个艺术动作，那么包括这个引腰、引背、引膝，那么也就是说，古人从很久以前就知道，通过应用运动疗法去治疗这个颈肩腰腿的这些疾病，去达到治疗疾病、提高功能的这么作用。
About 2,200 years ago, the Daoyin had already existed, and we can see the Daoyin picture. It involves 44 Daoyin movements, including the yin yao, which means extending the waist for lower back pain, yin bei, extending the back for back pain regulation, and yin xi means extending the knees for knee pain regulation. So we can see that that ancient Chinese people they can since a very early time they know how to use exercise as a treatment to cure their pain, to cure their to regulate and to promote their health.
包括这个华佗的五禽戏，它是距今已经有1700，就包括它模仿这个5种动物的形态和动作，去达到调整这个身心的目的。
Another example is 华佗五禽戏. The other name is 5 animal games, which had appeared since 1,700 years ago. By moving like these 5 animals, people could regulate their health.
那么还有这个我们熟知的这个八段锦，距今已经1000多年。那么包括图里面所圈出来的这些动作，都是通过各式各样的动作去调整我们整个人体的身心状态，去达到预防疾病或者说治疗疾病的这个目的。
And 八段锦, nowadays we are all familiar with it. We can see this movement that appeared in the picture, and 八段锦 had over 1,000 years of history. Since that time, people they know how to use their limbs, how to exercise to regulate their mind-body exercise to prevent or treat diseases.
好，那么我们讲到这个中国传统运动疗法，就离不开它的整个核心，就是我们说的意气性。
Mind, breath, and body is the core of TCET, and it is something that we could not avoid talking.
它的核心和精髓就是我们说的意气性，也就是说，我们如何用我们的意念去带动这个呼吸和身体的活动，如何让这个呼吸和活动相互相协调，让这个能量，就是这个我们古文字的这个气，在身体当中能够跟随我们的意念，跟随我们的呼吸还有动作，在体内能够自如的流动，从而达到身心的协调、统一、宁静、平和的这么一个境界。
The core of TCET means we should know how to use the body to drive breathing and activities, and our body movement, how to coordinate the breathing of our body, and how to allow the energy to flow freely with our thoughts, with our breathing and body movement, so that we can achieve the unity, coordination, serenity, and peacefulness between our body and our mind.
就我的理解就是，那么它的形固然重要，包括我们能指导患者学习这个动作的时候，形固然重要，但是在这个基础上的话，必须有我们说意的指引，还有呼吸的这个调整，去匹配整个运动。那么所有的气功，它的最重要的核心就是调心、调息、调形，而且这个意和气是我觉得是位于更高级别的，它是一种体内的一种能量流动的这么一种方式。
Although the body movement is significant when our patients are learning this exercise, however, I think that is just a foundation based on we know how to exercise. It is important to guide our movement by our mind and to coordinate with our breathing. And I believe to regulate our mind, our breathing, and body is important in TCET. However, the E, that means mind, and Qi, the breathing, is more important than our body.
那么我们刚才听了前面这两位教授的精彩演讲，我之前也最近也翻译了不少的这个文献。那么还有我们自己我知道现在有很多我们体育大学的研究生、博士生。那么大家都知道这个我们说中国传统运动疗，它体现的就是我们的身心的模式。
After hearing the presentation from the last two professors, and recently I read a lot of literatures, and we communicate with the students and the teachers at Beijing Sport University. Now we can know that the TCET belongs to a kind of mind-body exercise.
这个身心锻炼的模式，它包含了以下，就是我们现在文献里聊到的很多很多的理念，包括有正念、冥想、瑜伽、放松技术、运动想象、感知训练，或者说我们叫认知学习，尤其是里面的我们刚才也提到的文献里面，或者各位专家提到的注意力、记忆力、执行功能，它还体现了或者包含了神经肌肉控制、运动在学习、脑的可塑性，那么呼吸控制、有氧运动、植物神经功能的调整，还有自我效能的管理等等。
The mind-body exercise could include the mindfulness, meditation, yoga, relaxation techniques, motor imagery, perception training, cognitive learning, including the attention, memory, executive function, the neuromuscular control motor, the relating brain plasticity, and respiratory control, aerobic exercises, autonomic nervous function adjustment, self-efficacy management, etc.
刚才吴教授提了很多问题，觉得正好跟我这个 PPT 正好是相应。他提到我们怎么去挑选这个太极的教练，那么我们在给予这些太极或者其他的气功形式的时候，我们怎么去把控它的整个给予的这个干预是同质化。
And just now, Professor Wu, and he ever mentioned this question that how can we describe the qualified Tai Chi instructor? And here we can see that I think it is similar to my PowerPoint here. I think it is very important to think about how to set the exercise plan and how to implement it.
也就是说，你想让我们的祖国的传统运动疗法能达到形神俱备，或者说能达到它的精髓的话，那其中的关键点就是怎么样去规范落实这些我们说的训练的过程中的这些口诀，还有动作要领，那么保证这个训练的质量。
And if we hope to make our prescription or our exercise plan successful, it is important to standardize the implement of our oral instruction and the action essence.
那么，大家看文献的时候，是不是也会经常发现，哎，怎么都是太极气功，或者都是中国传统运动疗法？它有的时候的疗效会有参差不齐呢？文献里面或者说各位专家教授，他们早就意识到的问题就是，可能他给予的干预是不一样的，有的可能只重视了这个形，但是很多都没有能够真正的落实到形神俱备。没有落实到以意带动气、带动形这么一个精髓的东西。
And when we are reading some literature related to Tai Chi or Qigong research, we may always find an important question that although the study use Tai Chi or Qigong as the intervention, however, sometimes they may have some different results. Why we have this result? I think this is maybe because when they are doing the research, they only just care about the body movement, but they could not really combine the mind, the breath, and our body, and they ignore to use the mind to guide the flow of qi, and then the qi is flowing could lead the movement.
好，那么我们介绍完这些背景资料之后，我从一个康复医师的角度，从我们我们中医医院这个单位为出发点，去简要的阐述一下中国传统运动疗法在康复中的应用。
Now I would introduce how the TCET could be integrated into the modern rehabilitation.
那么我们看最近几年，我们看中国传统运动疗法，还有太极，还有这个八段锦等等这些疗法，其实最近几年它的文献量，或者说国内国际对于这些传统运动疗法的这个可行性还有意义，都是研究的非常热的。
We can see that in recent years, no matter the traditional Chinese exercise therapies, the Tai Chi or the Qigong, and there are lots of researches about their feasibility and their effect in both China and in the international universities or institutions.
那么我们这个传统运动疗法在康复中大概都运用于哪些领域、人群或者病种？
So, what areas can apply the TCET?
好，那么从目前的文献里面总结的话，或者说从我们的经验来说吧，其实刚才吴教授问了一个很好的问题，就是那么什么样的病人合适做中国传统运动疗法？
We must ask a question, and this question is also mentioned by Professor Wu. That is, what kind of patient could use TCET as a treatment?
那么从现在的文献，或者说从我们现在的实践上来说，或者说 从我一个以医学为背景的医生来说的话，只要这个患者病情是平稳的，或者相对平稳的，那么在医生的监督下，就慢慢就可以开始这些祖国传统运动疗法。
According to the recent studies and also the experience and my practice, I believe that if the condition of patient is stable and he can do this exercise under the supervision of the doctor.
那么文献上面的话，它的研究集中在以下几个方面。首先，最大的或者说我们整个中国传统运动疗法用的最多的就是一般人群的这个健康的，包括我们的预防、保健、健身的这么一些方向。
And most of the most people that can use TCET. The most people that they can use TCET is that people who are health. They can use TCET to prevent diseases and to promote their health.
那么文献里面总结的或者归纳的第二大部分，利用这个中国传统运动疗法去做研究的，就是有心理健康问题这部分。
And the second largest group of people that can use TCET as a treatment is that people who had some mental disorders.
那么排第三、第四位的就是老年人的干预措施，还有这个平衡和协调的干预，而且这两个有的时候是重叠或者有交集的。
The third and the fourth, the largest group is the elderly people and the people who need to improve their balance to prevent the fall. Sometimes the elderly people and the people who need to improve their balance are overlapped.
那么接下来的就是研究，有很多研究它会集中在高血压，就是中国传统运动疗法对高血压的这部分的治疗作用。
And also the people have hypertension and can also be the subject of TCET research.
还有一部分呢，就是带有认知功能障碍的，他通过这个中国传统运动疗法的研究，去明确或者去阐明它在对认知还有心理的各个方面的作用，还有。
And also there are some people that they have some cognitive disorders. They use TCET to improve their cognition and their mental skills.
那么最近几年的话，因为新冠肺炎这个全球的这个流行，那么这个中国传统运动疗法在呼吸系统里面的应用，尤其是在国内的研究，这几年大家也看到有很多的指南或者方案去改善这个新冠患者各种症状，去促进他们的康复。
In recent years, due to the outbreak of COVID-19, so there were lots of domestic researchers applied the TCET to intervene the respiratory system, and then there were lots of guidelines appear.
那么就像刚才这几位专家教授的演讲，是的。其他的各个方面的领域，包括心脏的领域，包括肿瘤康复的领域，包括别的领域，也在越来越多的应用中国传统运动疗法去证明或者说去研究这些中国传统疗法在这些领域当中有什么好的作用，还有它的作用机制到底是什么。
And just like Professor Yang and Professor Wu, they have mentioned in recent years, there are lots of researchers. They try to investigate the effect or the mechanism of TCET in lots of other areas.
那么我们说，这个中国传统运动疗法在康复中的应用啊，除了我们刚才说的这个，那么我们从教学、从我们临床的角度，在我们医院的话，它是怎么用的？
Besides these areas we have already mentioned, how can we apply TCET in the teaching and the clinical situation?
那么我们医院的话，还有另外一个身份，就是我们医院是中西医结合的国家重点单位，就是国家级的中西医结合医院。
And our China-Japan Friendship Hospital is also a national level hospital of the combination of traditional Chinese medicine and the Western medicine.
我们医院有很多的中西医结合的科室，包括中西医结合的内科、中西医结合的肺病科、中西医结合肿瘤科等等。他们在用这些中国传统运动疗法啊，它是同时结合其他的，包括针灸、包括汤药、包括推拿按摩等等，去结合来用。
And there are a lot of departments in our hospital. They use Western and Chinese traditional Chinese medicine combination, especially some ways of needles, some herbal soups to treat diseases. They combine these traditional approaches into ordinary Western medicine treatment.
那么在我们科是怎么用的呢？就是这个是刚刚我们给大家呈现的打勾的这些地方，其实就是我们中间有涉及到我们中国传统运动疗法这个项目。
Here we can see the picture. In fact, we have shown it in the formal slide, and in our department, the areas in red, they are some areas that we can use the combination of Western medicine and traditional Chinese medicine.
那么大家可以看到的话，在我们医院的康复科的话，大部分的亚专业的康复对这个中国传统运动疗法都是有涉及，尤其是如果说他是住院的患者，那就是病情相对稳定，他的功能力水平相对好的这部分患者。另外的话，还有很多门诊的患者，他们的功能力水平相对比较好。那么我们会把中国传统运动疗法用于这些患者。
You can see that the most in our daily treatment that we can use the integrated traditional Chinese medicine and Western medicine in this area of in this areas of rehabilitation. And if the people he is in a hospital and they may have a better application of this method.
那么我们举两三个例子，就是我们有两项国家级的，一项市级的临床创新的技术，包括慢性呼吸系统的康复、外科加速康复的临床实践，还有帕金森患者的姿势控制技术。
In our department, we have 2 national and 1 municipal clinical innovation technology. Including the rehabilitation of chronic respiratory diseases, clinical practice, and surgical accelerated rehabilitation, posture control techniques for patients with Parkinson's diseases.
尤其是 在这些患者临床疾病已经得到一定控制的基础上，在他的日常生活活动能力，包括站立、行走都已经具备一定的这个能力之后，我们就会把这个中国传统运动疗法给用于这些患者身上。
Especially for some patients after their disease is under well controlled, and if they can have the daily life ability to walk or to stand, we can use this TCET approaches in their treatment.
同时的话，我们尤其是对于这些帕金森患者的姿势控制这一块，我们康复科是有一个很大的水疗康复系统的。那么我们就会让这些患者当然是在临床疾病管理的基础上，在水中结合水这个元素，去更好的去改善他的姿势控制，像他的日常生活活动水平。
At the same time, especially for some Parkinson's disease patient, they need to improve their posture control ability. If their disease is under well control, we will add the aquatic therapy into his original treatment to use water to help him improve his ability to control his posture.
那么同时的话，大家会问的就是，那么既然大部分患者在用这个中国传统运动疗法，它都是需要一定的认知水平，需要一定的生活活动能力。那相对比较重一点的患者，能不能使用？
There are lots of people. They have a question. They have a question that is, the practice of TCET need a basic cognitive level and the daily life ability. What could they do if their disease is severe?
那么我们可以在临床疾病的管理的基础上，刚才不是说了吗？气功有静功，有动功，尤其是对于呼吸系统这一块，利用这六字诀之类呼吸的这类的导引。那么在他还在早期呼吸相对困难、有焦虑、抑郁状态的时候，我们同时结合这样把这些元素给糅合、整合到我们的康复治疗中去，那么也取得了不错的效果。
We have mentioned that all of this must based on a well management or a good management of the disease condition, and we have mentioned qigong. It could be divided into static qigong or movement qigong, especially for some respiratory disease patient. They could choose some health qigong 六字诀 some health qigong like that to improve their respiratory function, and we could use this element in an early stage of his diseases to integrate all of these elements into rehabilitation. May product good effect of treatment.
那么这里就总结一下，在我们医院应用这个中国传统运动疗法中西医结合吧，它有几个应用的这个原则。
Here are some principles that integrate traditional Chinese medicine and Western medicine in our hospital.
那就是说，因为我们刚才我之前跟王教授，我问过王教授，这次我们参会的大部分有很多是我们的这个研究生博士生，那么我从他们的角度。
I have asked, I have inquired Professor Wang that today most of our participants are PhD and master degree students. So I will introduce this for you.
就是无论这个患者表面上有没有疾病，或者说他已经有是患病患者，那 那么其实从我们医疗康复的角度，第一个当然是要注意原发病的综合控制。
No matter whether the patient looks like he has disease or not, we must pay attention the primary whether he has primary disease.
那我们就要对这些原发的疾病进行综合的管理，这是所有康复的前提。
So we must have a comprehensive management of these primary diseases. This is the funding of all of our rehabilitation.
第二个的话，就是我们可以根据这个疾病的不同阶段，去给它设不同的康复处方，或者说这个传统康复的运动处方。
We can set the different traditional Chinese exercise prescriptions according to the different stage of the patient's disease.
那么第三个的话，因为我们这个单位也是有非常多的老年人和老年康复的患者。
Because because we have a lot of elderly patients need to do the rehabilitation in our hospital.
所以我们非常强调的就是这个直立位训练，还有这个24小时的康复管理。
So we emphasize on the up straight position training and the 24-hour rehabilitation management.
为什么要强调这个24小时的康复管理？或者说我们后面会提到的这个康复处方里面，你怎么去管理这个患者训练的程度？
Why it is important to do the 24-hour rehabilitation management, and how could we manage how could we control the intensity of the exercise?
那么我们说一天有24个小时，我们病房很多老师都是，如果你教他每天训练一次，每次训练半个小时，其他的时间他要的都以坐着为主，这样的话，整个的他每天的活动量是远远不够，那么他的卧床的并发症发生的概率会非常高。
Because there are 24 hours a day, and for most elderly people, if you require him to exercise one time per day and half an hour each time, then besides the time you require him to do this exercise, he will always sit or lie on the bed. In the long term, they may have some side effect related to long time lying.
那么所以说的话，无论是对于有疾病的患者，或者说他们的老年人来说，我们都得让他动起来。动起来这个方式，少量多次动起来的方式，就是我们的，包括我们的康复的活动，包括我们的很多传统的这个运动疗法。
So, no matter for rehabilitation or TCET, our goal is to let this patient and this elderly people move and let them always do some exercise, and they can do this exercise in a very small intensity, but do it for several times.
那么第4条的话，我们就说有一个很重要的康复的概念，就是这个 ICF。
And there is a very important concept in our rehabilitation, that is the ICF framework.
那么下一章 PPT 我们会讲到，那么我们在整个康复，或者说在我们整个健康人群的运动的管理当中，都可以用到这个 ICF。
No matter in the rehabilitation or the health management among healthy people, we can use ICF framework to guide our plan.
那么第5条的话，就是我们在给患者设定这个康复方案，或者设定这个中途传统运动疗法， 我们都要结合运动处方的元素。
When we are setting the exercise plan or exercise the prescription, we must follow the principle of exercise prescription.
那么第6个就是我们需要结合任务导向性的训练。
The next important principle is that we should combine the task-oriented training.
那么首先我们理解一下，什么叫任务导向性训练？
At first, we should understand what is the task-oriented training.
那么我举个例子，就是由坐到站，由坐着站起来这个动作。
I will give you an example. Now I ask you to stand up from sitting.
对，那么这个动作的话，会涉及到躯干的对位对线，涉及到重心的转移，还有我们用力的方向，还有平衡的控制等。
It is just a very simple, a simple task, but it will involve a lot of movement in this requirement, and we must control our balance. We must move the gravity of our center, etc.
那么我们说，对于大部分的中国传统运动疗法，它是一个整体的训练。
For most TCET exercises, they are holistic movement.
那么其实我们就算他做了这个中国传统运动疗法，无论说从我们的文献还是在我们的电子给患者练的时候，它是改善了他的包括力量耐力、包括平衡、包括协调等等。
No matter in the literature and in our practice, we can find that when patients doing this exercise, doing this TCET movements, they strength, their coordination and their balance can be improved.
但是这是一个整体性的提高，并没有达到说我要专门去提高，比方说我们说的这个由坐到站的这个动作，它其实并没有专门的练到这个。但是我们西医康复里面，它就会专门练，它会更具有指向性，更具有任务的导向性。那么举另外一个例子，就是我去拿瓶水喝这个动作。那么可能你在练太极的时候，也会对上肢的控制、对姿势的控制，也会有相应的训练，但是它还没有达到说我专门练这个动作那么精准，那么具有现实的意义，那么具有现实的可操作性。这个它只是整体的提高，并没有那么单一的任务导向性，是这个意思。
But it is a general improvement of our ability. It would not enhance our special function or the particularly part or exercise one particularly part, but in the Western in Western rehabilitation theory or exercise, they may exercise some single or special part or the single or special function of our body. It would be more accurate.
那么第7个的话，我们说我们在运动的过程中可以结合其他的物理因素，比如水疗等等。
In our process of rehabilitation, we can combine other physical therapies, such as the hydrotherapy.
那么在落实这一块的话，我们可以结合患者兴趣爱好，可以像刚才吴教授说的，医疗级的这个太极是先让他掌握了形，然后掌握了形之后，再把难度慢慢去提高，再最后就是形成具备，这样可能可操作性或者落实性会更好一点。
And for the implementation, we should combine the patient's interest and their hobbies to let the patients acquire this movement step by step. But following that, the patient could master this movement better.
这个就是我刚才说的结合 ICF，就是国际功能残疾和健康分类。
This is the ICF framework that I have mentioned in the last PowerPoint.
那么我们看看这个中间活动这一块，就是我们现在中国传统医学里比较着重的是这个。我们包括我们的坐站走或者打太极打气功，这个就是活动的这个词。
We can see that in the middle of this framework is activity. Our daily work, such as we walking, standing, perform Tai Chi or Qigong. All of this movements belongs to the activity level.
那么我们还可以从其他的几个方面的角度去设定我们的训练方案，包括从身体的功能和结构，包括从社会层面的参与方面，还有包括配合环境因素和个人因素这个，去整体的改善患者的健康状态，去促进他们。
You can see in the picture, we can, when we are setting the exercise plan, we can consider those elements of other aspects such as the function or the structure of our body, our personal hobbies and interests, the environment, and we can integrate those elements into our exercise plan.
同时的话，这个大家已经非常熟悉了，包括我们选择运动处方的要素，它的类型、它的强度，尤其这个强度，其实目前在各种文献里面都提到的一些共性，就是你怎么在做研究的时候，你怎么去把控它的强度，你这强度怎么给，对吧？力和气，这个怎么去控制，怎么去实施这个强度，这个才是最重要的。
FITDVP, now we all familiar with it, and this is principle of element choosing in exercise plan design. Especially we need to pay attention to intensity, and it is raised by lots of literatures that how could we control the intensity in our our intervention.
然后的话就是每次训练的时间，你整个训练拉的时长是多少？比方说有的是练10个礼拜，有的人是3个月。那么目前文献里面说到的话是说，你要想达到一定的效果的话，你必须每次得达到这时长得达到半个小时、半个小时以上。那么同时的话，你的训练的那个这个总的长度目前认为的话3个月左右，它的就12周左右，文献里面好多提到它的效果是比较好。
The time means the duration of the exercise, and in some literature it had mentioned that if you hope to achieve the goal of health promotion, you need to exercise at least 3 times a week and half an hour each time at least. The proper duration is about 12 weeks and about 3 months.
那么我们就是这个就是我们结合水疗，我们之前呢，我和王教授都是国际水中康复协会里面的一员。那么我们结合这个水疗的话，是能够把这个中国传统运动要实施的更好。
And this is an example of integrate hydrotherapy into TCET, and this is designed by Professor Wang Xiaojun, and this is the example.
那么 下面的话，我再说说这个 ICF 和这个 TCET 各自的优势。那么这个 ICF 我们刚才说了半天，那么 ICF 是在强调疾病综合管理的基础上，更强调它的实用能力水平，它的目标是让患者能够更好回归家庭、回归社会。同时的话，它强调因素和个人因素。那么同时的话，刚才我们说了，它更具备这个任务导向，具有更好的现实的意义，包括它的针对性，包括它的可操作。那么在这个的基础上去结合中国传统运动疗法，就能够更好的去改善患者的功能力水平，在更高的层次上能达到身心协调。
Now we will introduce the advantages of ICF and TCET. ICF emphasizes the improvement of practical ability on the basis of comprehensive disease management and with the goal of enabling patients to better return their family and society. And at the same time, it emphasizes the importance of environmental and personal factors, which has better practical significance. And on this basis, it can combine the traditional Chinese exercise therapy to improve patients' functional ability and achieve physical and mental coordination and serenity at a higher level.
那么中国传统运动疗法的话，它更突出的，像我们刚刚在讨论，更突出整体。那么除了形以外，它更重视这个意和气，在这个精神境界、意念或者说调息，这方面来说，在改善这个身心健康里面起着可能说比西方医学更有优势的作用。那么如果在这个基础上，我们再利用循证医学的证据去进行很好的临床疾病的系统管理，那么同时做好这个疾病的二级预防，可能会对部分的普通患者会获益会更多一点。
Traditional Chinese exercise therapy emphasizes the overall aspect, and it emphasizes not only the form, the body, but also the mental state, that is Yi. Yi plays an important role in improving physical and mental health. And on this basis, we using evidence-based medicine evidence for systematic management of clinical diseases and doing a good job in secondary prevention can have a better complement.
那我们看看目前的这个研究存在有什么问题。那么首先的话，就是我们说这个刚才反复提到的，或者说各位专家反复提到的，就是这个研究方法的局限性，尤其是我们在把控这个训练的强度、训练的时间、各种风格，包括你是用哪种形式的技工，这个老师是怎么给你指导的，你怎么样贯彻他的意和气这两个重要的核心的这个在研究方法里面，其实很多都没有聊到，也就是说，正是因为这个，可能就会产生各式各样的效果。
The next we will introduce some problems exist in recent studies of TCET. The first is the limitation of the research method, and including how can we control the duration, the intensity, and the style of the movement, and how the instructor guide you to do this exercise, to do this movement, and how will you implement. How can we control the implementation of the plan?
那么其实就是说白了，就是你能不能找到一个很好的气功的指导的老师，去把这个口诀和动作的要领，怎么样能够更好的去规范、去落实？那么这方面呢，很多文人可能各种研究者都意识到了这个问题，但是他没有很好的方法去把这些落实到。
It is important to find a qualified instructor to guide you and to implement the exercise plan. Although lots of researchers have realized this problem, however, they have no way to deal with it.
同时的话，我们还有以下几个方面的研究有一些问题，就是高质量的随机对照研究比较少。那么同时的话，中国传统运动疗法像我们刚才说的，需要一些基础的认知活动水平。那么同时，它也缺乏一些任务指向性的这个训练。
Some other problems exist, such as now they have very few high quality RCTs, and the TCET need a basic level of cognition and activity, and it lack the task orientation.
那么最后的话，我说一下这个展望。
Finally, I would like to talk about the prospect for TCET.
那么从我浅显的这个理解，那么其实跟王教授也说过，那么能不能在国内出版一个相关的书籍，把这些我们传统的运动疗法的这个实施的过程中的关键点、口诀、动作要领给写进去，给落实到位，就落实它的意气这三个这个重要的精髓。
In fact, I have discussed with Professor Wang that can we publish some relevant guide or books to clarify and unify the key points, oral instruction, and action essence of TCET.
在刚才这一点基础上开展一些更高质量的临床研究，那么进一步去揭示我们中国传统运动疗法在改善认知、神经肌肉控制、植物神经功能、精神心理这一块去产生这些机理，从而更好的去普及我们中国传统运动疗法。
On the basis of step 1, and maybe we need to carry out some high quality clinical researches to further review the mechanism of improving cognition, neuromuscular control, mental psychology, autonomic nervous function, and some other aspects to deepen the popularization of TCET.
那么最后一点就是希望我们能做到结合其他的干预措施，包括水疗这些，那么从而更好、更深入的去推广、普及我们的中国传统运动。
I wish we can combine some other intervention measures such as hydrotherapy to better popularize and promote TCET